Hello, I'm Dr. Amelia Carter, a family physician with more than 10 years of experience caring for adults just like you, people in their 50s, 60s, and beyond who want to feel strong, energized, and truly in control of their health as the years go by. I'm about to share something that might feel surprising at first, maybe even a little backwards, but by the end of this conversation, I promise it will make perfect sense and could genuinely help you take back control of your blood pressure in a way that feels safe, sustainable, and empowering. Many of us over 50 have been told that high blood pressure is just part of aging, something we manage with pills for life, or something that's mostly about too much salt or fluid in the system. And while those things play a role, they're only part of a much bigger picture, one that's been quietly misunderstood for decades. The truth is, hypertension after 50 isn't simply a plumbing problem of too much pressure in the pipes. It's a story of structural changes happening inside your arteries at a microscopic level, changes that no pill alone can fully reverse, but that you can influence meaningfully with the right understanding and gentle steps. I've seen this in my practice time and again. Patients who follow the usual advice, take their medication, cut salt, check their numbers, and still end up with rising pressure, fatigue, or complications because the underlying damage wasn't being addressed. By the end of this video, you'll understand the 3 hidden mechanisms that drive hypertension as we age, why the standard fluid volume explanation is incomplete, and the 4-step approach that research and real patient outcomes show can actually help reverse the damage, not just manage the numbers. This isn't about fear or throwing away your medication. It's about clarity, precision, and hope, because your arteries are still capable of healing, remodeling, and becoming more flexible, even after 60. Let me tell you about a patient named Harold. Harold was 73, active, disciplined, and proud of his health routine. He checked his blood pressure every morning, took his prescribed medications faithfully, and kept his salt low because that's what he'd been told. His readings were often controlled, around 128/82, so everyone felt good about it. Until one morning, he collapsed from a stroke. When we looked closer, the damage was clear. His arteries were stiff, calcified, rigid in places. His heart had been working against hardened pipes for years. The medications had kept the numbers down on paper, but they hadn't stopped the structural changes inside his vessels. Here's the uncomfortable but empowering truth. Blood pressure is not just about fluid volume or salt. It's about living tissue, your endothelium, the delicate inner lining of your arteries, the glycocalyx, a protective microscopic coating, the middle layer of smooth muscle and elastic fibers that should stay flexible, and the way your kidneys handle sodium when insulin levels are off. These are the real drivers, and when they're damaged, hypertension develops and progresses, even when the numbers look okay. This is why so many good, well-meaning people follow the rules and still face complications. The standard approach manages the symptom, the pressure reading, without always addressing the cause, structural damage at the cellular level. But the research is now very clear on how to begin reversing that damage, not just controlling it. Stay with me, because what you're about to learn could help you protect your heart, brain, and independence in ways that go far beyond chasing a number on a monitor. Before we go deeper, I'd love to hear from you. When you think about your blood pressure, which part worries you most? The top number, the bottom number, or just the idea of being on medication long term? Drop a quick comment below. Your thoughts help me understand what matters most to you and build this supportive community where we all learn and protect each other. I read every comment, and they mean a great deal to me. Let's keep going calmly and clearly, because knowledge like this gives you real power and hope. You're not too late, and you're definitely not alone. If what you've just heard is already resonating with you, if you've ever felt frustrated with your blood pressure numbers, wondered why they keep creeping up despite doing everything right, or simply want clearer, more empowering ways to protect your heart and arteries, please tap that like button right now. It really does help this calm, caring conversation reach more adults over 50 who might be quietly asking the same questions. If you haven't yet, hit subscribe and turn on notifications so you never miss these gentle, evidence-based talks made especially for people who want to stay strong, independent, and hopeful as the years go by. And most importantly, Leave a quick comment below. When you think about your blood pressure, which part worries you most? The top number, the bottom number, or just the idea of being on medication long term? Or simply share your age and where you're watching from today. I'd love to know. Your honest thoughts help me understand what you're experiencing, shape future videos around what truly matters to you, and build this warm, supportive community where we all look out for each other's health. I read every single comment, and they mean a great deal to me. Let me share a story from my practice that I think about often, because it captures the quiet frustration so many people feel. Harold was 73, active, disciplined, and proud of his health routine. He checked his blood pressure every morning, took his prescribed medications faithfully, and kept his salt low because that's what he'd been told. His readings were often controlled, around 128/82, so he and his previous doctors felt good about it. He walked daily, ate reasonably well, and never missed a dose. Until one morning he collapsed from a stroke that no one saw coming. When we looked back, the damage was clear. His arteries were stiff, calcified, rigid in places. His heart had been working against hardened pipes for years. The medications had kept the numbers down on paper, but they hadn't stopped the structural changes inside his vessels. Harold survived, but he needed months of recovery, and he said to me with quiet regret, "I thought I was doing everything right. I wish someone had explained what was really happening." This is the reality for far too many adults over 50. We've been taught to think of hypertension as a plumbing problem. Too much fluid in the pipes, so reduce salt, take a diuretic to remove water, and the pressure drops. Problem solved. And yes, that model can bring the numbers down temporarily. But it's an incomplete picture, one that's been outdated for decades and is quietly keeping people at risk. Hypertension isn't primarily about fluid volume. It's about the pipes themselves, your arteries, undergoing real structural changes at the microscopic level. When I talk to colleagues or review imaging and lab data, what we see is living tissue that's been damaged. The delicate inner lining, endothelium, becomes injured. A protective coating called the glycocalyx gets stripped away. The middle layer of smooth muscle and elastic fibers stiffens and calcifies, and the kidneys get locked into holding onto sodium because of elevated insulin. These aren't just abstract ideas. They're the actual changes happening inside millions of people right now, changes that no blood pressure pill can fully reverse on its own. Medications are important. They save lives by managing the pressure and preventing immediate crises, but they treat the symptom, the high reading, more than the cause, the vessel damage. That's why so many patients stay on multiple medications for years, yet still face complications like stroke, heart failure, or kidney decline. The underlying structural damage progresses quietly, even when the numbers look controlled. The hopeful truth is that these changes are not completely irreversible. Your arteries retain some ability to remodel, heal, and regain flexibility, even after 60. The research is now very clear on the three main mechanisms driving hypertension as we age, and the practical, evidence-based steps that can begin to address them at the cellular level, not just manage the number on the monitor, but actually help reverse the damage. Stay with me, because understanding these mechanisms gives you real power. You're not helpless against aging or essential hypertension. You're not doomed to medication for life. With gentle, consistent care, many people can lower their pressure significantly, reduce their medication needs, and feel stronger and steadier than they have in years. Let's start with the first mechanism that drives hypertension as we age, one that most people have never heard explained, and one that no blood pressure pill can fully repair on its own. Your arteries are not just passive pipes carrying blood. They are living, active tissue with multiple layers, and the innermost layer, the one that touches your blood, is called the endothelium. This is a single layer of cells, thinner than tissue paper, that lines every blood vessel in your body. Far from being a simple barrier, the endothelium is an active organ. It produces chemicals that control blood flow, prevent clotting, regulate inflammation, and keep your vessels healthy and relaxed. When the endothelium is healthy, your blood pressure stays normal. When it's damaged, hypertension begins and progresses. But here's something even most doctors don't emphasize enough. The endothelium itself has a protective coating, a microscopic layer called the glycocalyx. Think of it as a soft, slippery, gel-like Teflon coating on the inside of your arteries. This coating is only a few micrometers thick. You can't see it with the naked eye, but it's one of the most important structures in your entire cardiovascular system. The glycocalyx does several critical things. It creates a smooth, slippery surface so blood flows without friction or turbulence. It acts as a shield, preventing inflammatory molecules and white blood cells from attaching to the vessel wall. It senses blood flow and signals the endothelium to release nitric oxide, a gas that keeps vessels relaxed, open, and flexible. When your glycocalyx is intact, your arteries stay healthy, elastic, and protected. Your blood pressure remains stable. But when the glycocalyx is damaged or stripped away, everything begins to fall apart. The main things that damage the glycocalyx are high blood sugar spikes. Even if you don't have diabetes, post-meal spikes above 140 milligrams per deciliter cause glycation, where sugar molecules bind to the coating and break it down. Chronic low-grade inflammation from stress, processed foods, poor sleep, or excess weight. Oxidative stress, free radicals from smoking, pollution, or metabolic imbalance. Once the glycocalyx is damaged, the endothelium becomes exposed. Inflammatory molecules attach. White blood cells stick. LDL cholesterol penetrates the vessel wall. Plaque begins to form. The endothelium stops producing enough nitric oxide. Your vessels constrict and stiffen. Blood pressure rises. This is the first mechanism of hypertension, glycocalyx destruction, and endothelial injury. And here's the critical point. No blood pressure medication repairs the glycocalyx. ACE inhibitors, calcium channel blockers, beta blockers, diuretics, they manage the pressure reading by relaxing vessels or reducing fluid volume, but they don't restore the protective coating. They put a band-aid on the symptom while the underlying damage continues quietly. That's why so many patients on medication still face complications. The numbers look better, but the vessel lining remains injured, inflamed, and vulnerable. The disease progresses even when the monitor says controlled. The hopeful part is that the glycocalyx can heal. It's not permanent damage. Your body has the ability to rebuild this coating when the right conditions are met. The key steps to restore it include stabilizing blood sugar to prevent glycation, avoiding refined carbs and large post-meal spikes, reducing oxidative stress with antioxidant-rich foods, berries, leafy greens, dark chocolate, green tea, providing building blocks like sulfated polysaccharides from seaweed sources such as fucoidan supplements or occasional seaweed in the diet, which studies show can help thicken and repair the glycocalyx. These are gentle, food-based, and lifestyle changes, not exotic or expensive. When the glycocalyx heals, the endothelium can function properly again. Nitric oxide production improves. Vessels relax. Inflammation calms. Blood pressure often begins to ease naturally. Harold's story didn't have a happy ending because no one addressed this early enough. But I've seen many patients since then who focused on glycocalyx repair and watched their pressure trend downward, often needing less medication over time. They feel steadier, breathe easier, and regain confidence in their bodies. This isn't theory, it's cellular biology. And it's one of the most empowering things you can do for your arteries. Let's move to the second major mechanism that drives hypertension after 50 or 60, one that explains why so many people feel their blood pressure is just aging, and why medications alone often aren't enough to stop the progression. This is arterial stiffness and calcification. When I talk to colleagues or review imaging studies, one of the clearest signs of long-standing hypertension is how the arteries themselves change. A healthy artery is elastic and flexible, like a soft rubber tube. When the heart pumps, the artery expands to absorb some of that pressure, then recoils to help push blood forward. This elasticity smooths out the pressure wave and keeps both systolic and diastolic numbers balanced. But after years of elevated pressure, or even before symptoms appear, several things happen inside the artery wall, particularly in the middle layer called the tunica media. Calcium deposits form. Calcium belongs in bones, not blood vessels. But chronic inflammation, oxidative stress, and other factors cause calcium to migrate from the bloodstream into the vessel wall, where it forms crystals. Elastic fibers break down and are replaced by stiff collagen. Smooth muscle cells in the wall undergo changes. They start behaving more like bone cells, actively depositing calcium and hardening the structure. The result is an artery that feels crunchy and rigid instead of springy. In surgery or imaging, we see this clearly. Healthy arteries stretch and recoil. Hypertensive arteries resist, crackle, and sometimes barely allow a needle to pass through the thickened wall. This stiffness is what causes isolated systolic hypertension. The top number rises while the bottom often stays normal or drops. Why does this matter so much? Because stiff arteries create a wide pulse pressure, the gap between systolic and diastolic. A normal pulse pressure is around 40 to 50 millimeters of mercury. When it widens to 60, 70, 80, or more, like 160 over 80 or 150 over 65, it becomes a powerful predictor of serious outcomes. Research from the Framingham Heart Study, the Rotterdam Study, and recent meta-analyses shows that wide pulse pressure is independently linked to higher risk of stroke, heart failure, cognitive decline, and kidney damage, even when the diastolic looks normal. The danger is mechanical. Stiff arteries can't absorb the force of each heartbeat. That high-pressure wave slams directly into smaller vessels in the brain, eyes, and kidneys, causing micro-damage over time. The heart works harder against unyielding pipes, eventually leading to thickening of the heart muscle and heart failure. And because the stiff aorta can't recoil effectively between beats, diastolic pressure drops, which can reduce blood flow to the heart muscle itself. Here's the part many are never told. This stiffness and calcification are not completely irreversible. While arteries lose some elasticity with age, they retain the ability to remodel and improve when the right conditions are met. The research is clear that targeted steps can slow progression, stabilize plaque, reduce calcification, and in some cases, modestly reverse it. The key partners here are vitamin K2, especially negative 7 Malawian Quatches form, which activates proteins like matrix GLA protein that prevent calcium from depositing in arteries and redirect it to bones. Adequate vitamin D to support proper calcium use in bones. Magnesium, which helps keep calcium dissolved and prevents crystal formation in vessel walls. Studies show that consistent K2 intake, 100 to 360 micrograms negative 7 Malawian Quatches daily, slows or halts arterial calcification progression, and in combination with D and magnesium, can lead to measurable improvements in vessel flexibility and pulse wave velocity, a direct measure of stiffness. Many patients who've added these cofactors while addressing inflammation and blood sugar see their systolic pressure trend downward over months, often needing less medication. They report feeling steadier, with less fatigue and better exercise tolerance. This isn't about overnight miracles. It's about giving your arteries the support they need to heal and stay flexible. You're not fighting an unstoppable aging process. You're working with your body's natural repair systems. Let's move to the third major mechanism, one that explains why so many people over 50 struggle with high blood pressure even when they cut salt carefully, take their medications, and do everything right. This is what I call the insulin-kidney lock, and it's one of the most common yet most overlooked drivers of hypertension in our age group. Your kidneys are designed to keep your blood pressure stable by carefully controlling sodium. When you eat salt, your kidneys are supposed to excrete the excess in your urine. When you eat very little salt, they're supposed to hold on to every bit of sodium to maintain blood volume and pressure. This is a beautiful, finely tuned system that evolved to keep us alive through times of scarcity. But in modern life, especially after 50 or 60, this system gets disrupted by something most people never connect to their blood pressure: chronically elevated insulin. Insulin isn't just about blood sugar. It's a powerful hormone that tells your kidneys to hold on to sodium, no matter how little salt you're eating. When insulin levels stay high, your kidneys lock into retention mode. They recycle almost every milligram of sodium that passes through them, even if your diet is low in salt. This causes your blood volume to stay elevated, your pressure to rise, and the strain on your arteries to continue. This is why strict salt restriction often fails for so many seniors. They cut sodium to 1,500 milligrams or less, follow DASH diet advice perfectly, and their blood pressure barely budges, or improves only modestly. The kidneys are locked. Insulin is telling them to hold on tight. Why does insulin stay high after 50? Several reasons. Insulin resistance builds gradually with age, even without full diabetes. Your cells become less responsive to insulin signal, so your pancreas produces more insulin to compensate. Fasting insulin levels creep up, often 10 to 20 U/ml or higher. Normal is under 10, long before blood sugar or A1C shows problems. Frequent eating, snacks, large meals keeps insulin elevated for hours each day. Abdominal fat increases insulin resistance further, creating a cycle. The result: your kidneys stay in sodium retention mode. Blood volume stays high. Pressure stays elevated. And no amount of salt cutting alone can fully unlock it while insulin remains high. This is the mechanism many are never told about. Doctors often check glucose and A1C. If those are normal, they assume insulin is fine. But you can have normal glucose with high insulin for years. During that time, the high insulin quietly drives hypertension, damages vessels, and contributes to weight gain around the middle. The hopeful part is that this lock can be opened. When insulin levels drop, kidneys regain the ability to excrete sodium normally. Blood volume normalizes. Pressure often begins to ease, sometimes dramatically, without needing more medication. The most effective ways to lower insulin include time-restricted eating, e.g., 16:8, eating within an 8-hour window, fasting 16 hours. This gives long periods with no insulin spikes, allowing baseline insulin to fall. Resistance training, weights or body weight exercises 2 to 3 times/week. Muscles become more insulin sensitive, so less insulin is needed. Foods that improve insulin sensitivity: vinegar before meals, cinnamon, berries, fiber-rich vegetables. Many patients who've added these steps see their fasting insulin drop, sodium excretion improve, and blood pressure trend downward over months, often needing less medication. They feel lighter, less bloated, and more energetic. This isn't about extreme fasting or heavy lifting. It's gentle, sustainable changes that work with your body's natural rhythms. You're not fighting an unbeatable, essential hypertension. You're addressing real, fixable mechanisms. Let's keep going calmly and clearly, because understanding this opens the door to meaningful, lasting improvement. Now that we've clearly understood the 3 hidden mechanisms behind hypertension after 50 or 60, glycocalyx and endothelial damage, arterial stiffness and calcification, and the insulin-kidney lock, let's talk about what actually works to begin reversing them. This isn't about quick fixes or overnight cures. It's about gentle, consistent steps that support your body's natural ability to heal and remodel at the cellular level. Many patients who follow this approach see meaningful improvements in their blood pressure, reduced need for medication, and better energy and well-being over months, not years. The protocol has 4 interconnected steps. Each one addresses a core mechanism while supporting the others. Start with 1 or 2 that feel easiest for you, then build from there. Always work with your doctor. Never stop or change medications on your own, and monitor your pressure regularly at home. Step 1. Restore the glycocalyx and protect the endothelium. The glycocalyx is your artery's protective inner coating. When it's damaged, inflammation and plaque begin. To help rebuild it, stabilize blood sugar to prevent glycation spikes. Choose whole foods over refined carbs. Avoid white bread, sugary drinks, large portions of pasta/rice. Keep post-meal blood sugar below 140 milligrams per deciliter if possible. Increase antioxidant-rich foods to reduce oxidative stress. 1 to 2 cups berries daily, 2+ cups leafy greens, colorful vegetables, green tea, dark chocolate, 70% plus cocoa. Consider sulfated polysaccharides for direct glycocalyx support. Fucoidan from brown seaweed supplements, 500 to 1,000 milligrams daily. Discuss with your doctor, especially if on blood thinners. Patients who focus here often see inflammation markers, like HSCRP, drop within 2 to 3 months, with steadier blood pressure and less fatigue. Step 2. Decalcify and restore arterial flexibility. Stiff, calcified arteries drive systolic pressure up and pulse pressure wide. To begin reversing this, vitamin K2, negative 7 Malawian Quatches form, 100 to 360 micrograms daily, activates proteins to pull calcium out of arteries and redirect it to bones. Studies show it slows or halts calcification progression. Pair with vitamin D, test levels first. Aim 40 to 60 nanograms per milliliter with 2,000 to 5,000 IU-D3 daily if low, taken with fat. Add magnesium, glycinate or malate, 300 to 600 milligrams daily, prevents calcium crystal formation and helps vessels relax. Follow-up imaging in some patients shows reduced calcification scores after 6 to 18 months, with systolic pressure dropping 10 to 20 millimeters of mercury and pulse pressure narrowing. Step 3. Boost nitric oxide production. Nitric oxide relaxes vessels and lowers pressure. To restore it, create shear stress with gentle exercise, 20 to 30-minute moderate walking most days, or isometric hand grip training. Squeeze at 30% max strength for 2 minutes times 4 sets, 3x/week. Studies show 10 to 15 millimeters of mercury systolic drop in 8 weeks. Practice nasal breathing during day and sleep. Tape mouth if needed. Increases nitric oxide up to 600%. Patients notice easier breathing, lower morning readings, and better exercise tolerance within weeks. Step 4. Reset insulin and unlock the kidneys. High insulin locks kidneys in sodium retention. To lower insulin, time-restricted eating, 16:8, eat within 8-hour window, e.g., noon to 8 p.m., fast 16 hours. Insulin drops during fasting, kidneys excrete sodium better. Resistance training, 2, 3x/week, body weight or light weights, improves muscle insulin sensitivity. Add insulin sensitizing foods, 1 to 2 tablespoons apple cider vinegar before meals, 1/2 to 1 teaspoon cinnamon daily, berries. Many see systolic drop 10 to 20 millimeters of mercury in 8 to 16 weeks, often reducing meds safely. Practical tips and safety start with 1 to 2 steps, e.g., nasal breathing plus time-restricted eating. Monitor BP daily, morning/evening averages. Track trends. Retest labs, A1C, insulin if possible, vitamin levels, every 3 to 6 months. Work closely with your doctor. Gradual med reduction only when BP consistently improves. Safety first. If dizziness, falls, extreme fatigue, or BP 180/120, seek care immediately. This protocol isn't about overnight reversal. It's about steady, cellular level healing. Many patients reduce meds, feel lighter, and regain confidence. You're not too late. Your vessels can still remodel. Thank you from the bottom of my heart for spending this full time with me today. I know how precious your energy and attention are, especially when you're thinking about your blood pressure, your heart, your arteries, and the years you want to live fully and independently, and I'm truly grateful that you chose to sit here, listen carefully, and reflect on what's really happening inside your body. It means a great deal that you're open to understanding these deeper mechanisms, the glycocalyx damage, arterial stiffness, the insulin-kidney lock, and that you care enough about your health to consider gentle, realistic steps that go beyond just managing a number on a monitor. You are someone who takes responsibility for staying informed. You pay attention to what your body is quietly telling you, you stay open to evidence that can guide you toward real healing, and you're willing to have thoughtful conversations with your doctor about what's truly best for you. That kind of caring, proactive heart is beautiful and powerful. It's exactly why so many people in their 50s, 60s, and beyond eventually feel steadier, breathe easier, move with more confidence, and reduce their reliance on medication when they address the underlying causes. Every quiet step you take moving forward, whether it's starting with nasal breathing during your daily walk, adding a few more colorful vegetables to your meals, trying time-restricted eating for a few days a week, beginning gentle resistance exercises, or simply asking your doctor to check your insulin or reevaluate your meds matters far more than you might realize right now. These aren't overwhelming overhauls or scary changes. They're kind, consistent acts of self care that support your vessels in healing, remodeling, and regaining flexibility. The research shows that when we address these mechanisms, restoring the protective coating, reducing calcification, boosting nitric oxide, unlocking the kidneys, blood pressure often normalizes gradually, sometimes dramatically, and many people feel lighter, more energetic, and more in control. Your body is still wonderfully capable of responding at 50, 60, and beyond. You deserve to feel strong enough to enjoy your days, to walk without fatigue, to think clearly, and to be present for the people and things you love. Be patient and kind to yourself as you move forward. Some changes will feel easy right away, others may take a little time or a conversation with your doctor. Progress isn't always linear, but it is real, and you're already on the path simply by being here and choosing to learn. I'm honored to have walked this conversation with you. Thank you again for your time, your trust, and the quiet courage it takes to stay engaged with your health the way you do. You're doing wonderfully, truly. Take good care of your heart and your vessels. Start with one small step when it feels right, and know that you have every reason to feel hopeful, empowered, and protected moving forward. Until next time, be gentle with yourself, savor the small wins, and remember, your body is still listening, and you're giving it exactly what it needs to heal. Take care, and may your days be filled with steady strength and peace.